Hello, I am Dr. Zakir, Senior ENT Consultant. Today, I will tell you about the condition called mumps. This usually results because of a virus infection and it's more common in children. Now, once the virus which is transmitted through airborne or direct contact, once it enters our body, you have a state called viremia where it spreads throughout the body, and at the same time you have so many complaints which I will tell you one by one. As I have mentioned earlier, this results because of a virus infection which belongs to a particular family and is more common in children, and it affects both the parotid glands, salivary glands. Now, the common presentations are, to start with, they will have vague complaints like fever, headache, muscle pain, joint pain, general tiredness. And in due course, like within 3 or 4 days, they will have enlargement of both parotid gland and it starts to become painful and they will not be able to open their mouth properly. When they open their mouth, it will be painful for them. And along with that, you may find body rash also, red color rash also. All these are self-limiting and with due course it goes off. And there are less chance of complication in children. There are, but less chance of than in adults. But usually the same disease that affects the adults, they have more severe disease than the younger age group. Now, how to come to a diagnosis? When you do a simple blood count, it may give us an indication that it's a viral infection. To confirm whether it is mumps or not, we can do complement fixation test, heme agglutination inhibition test, or serum salivary amylase test. Coming to the treatment. So, to start with, complete bed rest and isolate the child from other children so that it doesn't spread, and ask him to drink a lot of water. If febrile, or if there is high fever, you can give syrup paracetamol, and advise to brush the teeth twice daily, 2 times daily. And suppose if we suspect secondary superadded bacterial infection, we will give a course of antibiotic too. And there are so many complications because of mumps. If these complications result, and if these can be treated with steroids, and when we have any complications, then we can give a course of steroids too. It's always better to be in balanced diet, soft diet, and to avoid sore food items. If both the parotid glands are painful and it doesn't come down, the pain doesn't come down with paracetamol, can apply ice packs over it. What are the complications? It can affect the brain, the disease can affect the brain, or in ladies it can affect the ovary, then pancreas, the kidney, and in males it can affect the testis, facial nerve it can be affected, heart can be involved, and they can have hearing loss also. It can be sensory neural hearing loss. These are the common complications. Coming to prevention, we have 2 doses of MMR. So, this MMR vaccine is scheduled in all the vaccination schedule. The first dose will be between 12 to 15 months and the second dose will be between 4 to 6 years. So, this is how we manage a case of mumps. Thank you so much.